So my name is Jeff Lazarus. I'm an associate research professor at IS Global, where I also teach in the Masters of Global Health program. And it was through that program that I learned about global health next generation from one of the students who was active in organizing the first conference, which was held 3 or 4 years ago now in Barcelona, where I gave a talk and moderated one of the plenaries. So I had a bit of a complicated career path. I studied Latin American Studies at New York University, went on to the School of Foreign Service at Georgetown University, and from there I did a Master's of International Health, actually almost 10 years later, when I made a career shift at the University of Copenhagen and the London School of Hygiene and Tropical Medicine. And then I was working at the World Health Organization, and one of the directors was starting a program at Lund University, the largest medical school in the Nordic countries. And I joined him to do a PhD in public health and social epidemiology. So I was living in Copenhagen and taking the boats before the bridge was built every day over to Lund University. So I think when applying, it's extremely important to tailor your application. You have to write that application to convince the other person and mean it, that this is the job or this is the research proposal that you believe in, that you want to win. So that means doing some research and making each proposal or each letter for a job different. You can recycle parts, but don't reuse the entire letter or proposal. So I was lucky, as I mentioned, to have had various master's degrees and a very broad public health PhD. So that's helped me take on a job, as a professor in global health, where you need to be, sometimes you would say, a jack of all trades and a master of none. You're a master of public health, but it allows me to have a large vision to understand a number of different disciplines and to try and bring it all together. So it's helped me build networks, utilize them for research. That's really come through here in the COVID-19 pandemic, where I've been able to call on the former minister, various former ministers of health, the former commissioner of the European Union for Health, other researchers I know from around the world, from when I was at WHO and at the Global Fund. So having that broad background and large network has helped me sort of fulfill that goal of trying to make global health changes, policy changes at the highest level. Well, my other areas of interest personally, they include literature, film, various sports, particularly professional cycling, although that's changed a bit with all of the recent doping scandals. I like to travel. I travel a lot. Recently, I haven't been able to travel so much. That's been nice, but I like exploring cultures, really, meeting people, reading, watching films. So for me, global health is very different than its origins, which were tropical medicine, international health. Global health is really about the health of everyone, leaving no one behind. So my work as a global health professional and the larger picture, I've been lucky enough to be at WHO and at the Global Fund, where we worked on the European level in 53 countries, and at the Global Fund working in 150 different countries. I was in charge of the results report there that covered all of the Global Fund's results in AIDS, tuberculosis, and malaria. So I think my professional career has helped me in global health move out of maybe a particular country or a particular focus and have more of a broad impact on health systems and policy, particularly in the areas of infectious diseases. So for a student who wants to work in global health, make sure you get practical experience to take your internships, travel to the countries you're studying, read a lot, meet people, engage as much as you can, and have a very open mind and broad understanding of global health. Make global health what you want it to be, whether that's more of a focus on economics or medical anthropology or epidemiology, various types of epidemiology, or utilization of biostatistics, mixing up qualitative and quantitative methods. Whatever you decide, make global health yours. That's the starting point for your global health journey.